my name is Marlette, and in this video I will be talking about euthanasia, and as well as some normative theories that we have analyzed in this class. So to begin, I want to state a life truth, and that is that nobody can outrun death. Society, we have all learned to accept this. So while euthanasia does end with death, it's not quite perceived the same way, and that's why there's been so many discussions and debates to try to see if this procedure, this action is morally correct or incorrect. So after carefully analyzing several of these ethical arguments, I have reason to believe that the deontological approach is more ethically justifiable, because according to the first and second form of the categorical imperative, euthanasia is morally incorrect. And while the utilitarian perspective does present a counter-argument that's worth looking into, it does not fully justify euthanasia. So in this video, I will be talking specifically about active euthanasia, which is an active intervention, for example, like a physician administering a lethal drug or using other means that cause a person's death. And according to the deontological approach, moral obligation is categorical, universal. So in this first form of the categorical imperative, we have to, it basically states that we can only do what we can accept that everybody will do. It's so basically, if we have a situation and we have to decide, okay, what is ethically correct? Here's option A, here's option B. And we have to consider both options and take whatever option it is that we want to decide if it's right or wrong, and basically turn it into a universal law. So in this scenario that we're talking about, euthanasia, if everyone had access to this simple and fast procedure that would ultimately end with their life, then these individuals could choose this option instead of looking for other alternatives that could help them, possibly gain a better perspective of their situation. Basically, in this first form of the categorical imperative, from this deontological view, euthanasia would be morally incorrect, because, like I said, people could very easily choose this option and not consider other options that could possibly, help them improve their situation. In the second form of the categorical imperative, we have to ask what constitutes proper treatment of persons as persons. And according to this form, people are valuable. So human life is very valuable. If we once again take this form and analyze our scenario, somebody's in distress, they request an active form of euthanasia, then once again we can see that this action would not be morally correct, because human life has no price. It's very valuable. And so if somebody's causing somebody else's death in a way that would be to purposely lower that person's valuable human life. Also, it's important to point out that while the deontological approach proves that euthanasia is not a necessary measure, it's important to point out that when we consider ethical dilemmas, we always have to look at other perspectives. And that's why I want to talk a little bit about the utilitarian perspective. So as John Mills explains, according to this perspective, actions are right in the proportion as they tend to promote happiness, and wrong as they tend to produce the reverse of happiness. So the utilitarian perspective, we have to look at a lot of the consequences. And whatever decision we want to take, once again, we have a problem. We're trying to decide which way to go. We have to consider all our options and see which one produces the greatest happiness. So it's a good counter argument, because if we take euthanasia and view it from this perspective, we can think that maybe to a certain extent, it might be morally a justifiable action. So somebody's going through a critical illness, and their sickness is causing them a lot of pain. It's causing his or her family a lot of pain. It's also maybe a financial burden to the family. There might not be a positive prognosis. if we look at this scenario, we can see, oh, well, ending this person's life in a way could make everybody lower their stress, make them produce the most happiness, in a sense. So if you look at it from that perspective, then yeah, maybe euthanasia would be a correct action. But once again, we have to center on the big picture. So there's the possibility that that person, the patient, is the only one who wants this to happen. He or she might be the only one wanting this to happen, but the rest of the family would be devastated if this decision was taken. So if we're trying to find the greatest amount of happiness and weigh it out, then we can see that euthanasia would probably not be the most correct decision, that there's other options this person could choose for. So in conclusion, we have analyzed several normative theories to try to see if euthanasia is morally right or wrong. And it's always important to look at different perspectives and not just focus on one solution. However, though, after carefully comparing the deontological approach with the utilitarian perspective, it is clear that Kant's approach in regards to the deontological perspective is more ethically justifiable. So euthanasia should not be an ethical option, morally ethical option, because while every case is different, we can conclude that the benefits do not outweigh the irreversible damages. So that's basically what I talk about in my essay about these normative theories and why euthanasia is not a necessary measure. So I guess if you have any questions, feel free to ask them or comment below. And that's it.